More Texans head back to work, but the state still faces concern about fast-spreading clusters of COVID-19.
And what we do anticipate is as we continue to open up the state for doing business, there will be some other hotspots that arise.
We'll look closer at the state's plan to respond to areas where coronavirus cases start to spike. All week on this station's website, we've revealed a mental health loop delaying justice for hundreds of Texas inmates. Now our investigation continues as we explore a 20-year-old Texas murder case and why the suspect has yet to be tried. Hello, and thank you for joining us for State of Texas. I'm Josh Hinkle. More Texans went back to work last week. Governor Greg Abbott announced that the state is in phase 2 of the Open Texas plan. The governor allowed bars, breweries, and tasting rooms to open just in time for Memorial Day weekend. Those businesses have to stay under 25% capacity indoors. They have a lot of other rules to follow, like restrictions on standing at the bar to order. Dancing is also discouraged. Gyms in Texas were allowed to open on Monday. They're limited to 25% capacity and they have to follow social distancing rules. And the governor's executive order allows child care facilities to resume caring for all children. Previously, that had been limited to children of essential workers. And come May 31st, the state will allow summer camps to open too. Now the state is deploying surge teams to areas where COVID-19 cases start to spike. Our Wes Rappaport spoke to Division of Emergency Management Chief Nim Kidd to learn more about the plan to control virus hotspots.
The hotspots that we talk about, Wes, are based on the percentage of infected people within a population. We know right now that nursing homes, meatpacking plants, and jails and prisons are the top 3 areas where we see outbreaks occur. What we're trying to do and doing with success is getting into those locations, testing everybody in the facility, trying to get a very rapid turnaround on those tests, which isn't always as fast as I want it to be, and making sure that we take people that are positive and keep them together and people that are negative and keep them together.
Emergency Management Chief Nim Kidd uses a wildfire analogy to explain how the state approaches a community where there's been an outbreak.
We've evacuated the area. Now we're letting people back in. We know that we're going to have hot spots, and we have these surge teams created to go and address those hot spots.
Every time we have pushed these surge teams into hot zones, they've met with very good results. What happens is over the first week you will see a massive increase in the amount of tests as well as the amount of people who test positive, and then after about 2 weeks you see a decline in both test and those testing positive, and you see a containment of the problem.
The surge response teams are spread across 60 locations in the state this weekend to help with testing, medical supply delivery, and sanitation.
We are currently helping with the disinfecting of all of our nursing homes, trying to do our best to help everyone out.
It has been very successful. It just takes a week or 2 to get through the process. And what we do anticipate is as we continue to open up the state for doing business, there will be some other hot spots that arise. But because we have the system perfected the way that we do, we think that we will be able to contain hot spots in Texas as we move forward.
Is there an effort to beef up local resources so that maybe fewer of these teams are needed around the state?
We want to continue our surge teams because we know there is a portion of the population that is positive but asymptomatic. Testing is the only way to do that.
Chief Kidd says the state is training local fire and EMS stations to help meet the governor's mandate of testing all of Texas's nursing homes.
It keeps everything local. It leaves us having to not send as many state agency responders in to help because our local government partners there have the resources to do the job.
What's the everyday job for the folks who are now on these surge teams?
They come from a wide variety of backgrounds. They're your neighbors. They're the Texans that wear the uniform. They're physicians to mechanics to other healthcare workers that we've actually had brought on recently, to auto mechanics, to construction workers, to sales force. I mean, they're all over the map. That's the beauty of the Army and Air National Guard here in Texas. But most importantly, they're Texans, and they're probably your neighbor. You may not have even realized it.
Can we tie this into hurricane season a little bit? That is quickly approaching, and I'd like to know sort of what the challenges are that your teams are facing as we still combat COVID-19, but also have this other set of dangers on the horizon.
Yeah, so while we are fiercely focused on the upcoming hurricane season, during this response we've had tornadoes in East Texas, we've had floods, we've had fires that have burned tens of thousands of acres. So we have coincidentally and coincidingly responded to other disasters besides COVID-19. Hurricane season poses a unique challenge for our coastal residents. One of the biggest challenges that we have already started working with our federal government partners on is congregate sheltering. As you're well aware, usually when we evacuate an area to get out of the surge, we put them in a gymnasium or some sort of school. So what we've already pre-vetted with FEMA is to use hotel rooms or other non-congregate sheltering for shelter space. Our Texas Military Department team, in partnership with the U.S. Army Corps of Engineers, has already started surveying buildings that are inland enough to be out of the surge zone, but strong enough to withstand the wind.
Even as Texas reopens, the state faces the financial fallout from closures caused by COVID-19. That has state leaders looking for ways to cut costs. Governor Abbott, Lieutenant Governor Dan Patrick, and House Speaker Dennis Bonnen sent a letter to state agencies and to colleges and universities in Texas. The letter asks each organization to trim 5% off their budgets for the upcoming year. That includes things like not filling non-essential open positions.
Of course, we're making certain that agencies like Workforce Commission are not a part of that at this time because they're producing an incredibly important service to Texans who need. And frankly, the sooner we begin the process of having agencies make these cuts, the less impactful it will have to be down the road.
Several agencies are not being ordered to reduce their budgets. Those include the Texas Department of Public Safety and Child Protective Services. The Texas Department of State Health Services is also excluded from the order. Benefits in Medicaid programs and the Children's Health Insurance Program are also exempt from the cuts. The battle to expand mail-in voting in Texas amid COVID-19 heated up in the courts last week. On Tuesday, a federal judge ruled that voters under age 65 could get a mail-in ballot during the pandemic. But on Wednesday, the Fifth Circuit Court of Appeals put that ruling on hold. Meanwhile, the Texas Supreme Court heard arguments in a state case aiming to let voters get a mail-in ballot if they're worried about getting coronavirus. The state's attorney general says there are other ways to keep voters safe.
The governor has just recently changed the dates for voting. Instead of 10 days of early voting, he's given 20 days of early voting. So as time goes on, there may be other ways that we can make it safer for people to vote. So we surely want to make sure that we have a safe voting location, as safe as we can, just like we have open grocery stores and open restaurants now. Nothing's guaranteed, and there's no guarantee that you won't contract corona, just walking around your neighborhood.
Democrats are leading the charge to expand access. Their lawsuits claim it's unconstitutional to require a person to risk their health to vote. Republicans claim letting more people vote by mail will lead to fraud. A family waits for justice after a murder 20 years ago. We investigate the problem that's keeping the suspect out of the courtroom. President Trump swears by it, but Texas doctors are divided on the benefits of hydroxychloroquine to fight COVID-19, why the state group that guides doctors is not recommending the drug.